I have always wanted to be a doctor since I was a child. I'm Catherine Lee. I'm a general gastroenterologist. Gastroenterology, I kind of fell in love with in medical school. My mom had passed away from colon cancer right at the beginning of my medical career, so that may have had something to do with it, but I also just fell in love with the pathology as I continued through my medical training, and I was lucky enough to be able to do it. So when I'm not working, I spend a lot of time with my family. I have 3 kids, so 10, 8, and 6. So they keep us very, very busy, but we like to travel. We take them skiing every year. We like to go to the beach. We're very active outside in the summertime. They like to go to the pool. We like to go on family bike rides, stuff like that. And then when I get a chance, I'll spend some time with my husband. Patients would come in to see me for multiple various reasons, anywhere from acid reflux or heartburn, difficulty swallowing, pancreatic disease, liver disease, gallbladder issues, abdominal pain, diarrhea, constipation, family history of colon cancer, or just simply for a screening colonoscopy. So when a new patient comes in with new symptoms that might be scary for them, I start just by listening to them, and it's mostly about the history, figuring out what's going on, how long it's been going on for, and then we start to do the diagnostic workup. But really, mostly it's just listening to the patient. Sometimes what's scary to them might be something that's very simple to fix. Most patients, when they're coming into a colonoscopy for the first time, they're most concerned about the bowel prep and the sedation. So what I always say is the bowel prep is the hardest part, but also the most important part. So it's not easy, but do your best. And then obviously the day of the procedure, they get sedation. So that can be nerve-wracking for some patients, but it's a very well-tolerated sedation, and the hard part is actually over the day of the procedure with the prep. Follow-ups can range anywhere from 2 weeks to months, depending on what we're dealing with, how often we're changing the management of their disease. If I'm changing it a lot, then I have them follow up a lot initially, and then once they're doing well, then I spread those follow-ups out a little bit. I love coming in to feeling that I've actually helped a patient feel better, help them work through their GI symptoms, and eventually figure out a plan that helps them to feel better. That's what I love about what I do.